Hi, I'm Dr. Geetha Bhavani Reddy. I'm working as a consultant obstetrician and gynecologist in Motherhood Hebbal from 9 to 11 a.m. It depends upon with the hysterectomy whether the ovaries are removed and what age the surgery has been done. If it is done at an younger age, less than 45 years, the hysterectomy along with the ovaries, they will have severe menopausal symptoms like osteoporosis, hot flushes, and maybe myocardial infarction. So it is best to start the hormonal replacement therapy immediately after the surgery. But if the ovaries are retained, they will have some hormones left, so they may not require hormone replacement therapy very quickly, but at the later stage if they have any symptoms. At a later age, if the hysterectomy is done with the ovaries are removed, depending upon the symptoms we can start, or empirically also some people do keep on the patient for HRT to prevent the future myocardial infarction.